Back at 8:13, a vicious coughing disease is spreading rapidly. Whooping cough cases have spiked across the United States and alarming, of course, this is alarming health experts all around the country. Dr. Reena Mehta joins us now with the best ways to protect yourself and, most importantly, your babies and small children from this. And it's not a virus, is it?
It's actually a bacterial infection.
Correct.
Exactly.
So, Dr. Mehta, we've heard about RSV. We know there's a vaccine for that, but this is not the same thing as whooping cough, right?
Yes, so exactly. So whooping cough is caused by a bacteria called Bordetella pertussis. However, we do have a vaccine against whooping cough. Okay, so that is your Tdap vaccine in adults and your DTaP vaccine in the pediatric population.
So let's talk about why this disease is so scary if a child, especially a small baby, gets this and they have not gotten any protections, be it through their mother or otherwise.
So the thing about the whooping cough is it causes this horrible, nasty cough. And we worry about our infants the most because the cough can be so severe that they can actually pass out from it, they can become apneic, and they can even stop breathing. Now, in our adult population or even our teenagers, it can still be a very bad cough. We actually call this illness the cough of 100 days because the cough just keeps going on and on and on. And it's a very violent cough, almost like you're having coughing attacks that can really knock your breath out.
How contagious is whooping cough?
Very contagious. And so if you're next to somebody who has it, it's through respiratory droplets, it's through contact. And so, you know, while we've had this vaccine for a long time, and it's a pretty good vaccine, because of the number of vaccine decline, I would say during the pandemic, a lot of people didn't get their shots, stayed home, or there's been a lot of vaccine hesitancy. That's why we're seeing this resurgence of whooping cough cases to the point where this year we have about 18,000 cases in the United States, whereas last year that was about 4,000 by just this time only, by October.
Wow, so really something that needs to be a handle needs to be gotten on this. And you mentioned the shot in adults, and you mentioned Tdap. That may be one that people are familiar with if they gotten a series of shots in the last few years or so. How long, if you've gotten that Tdap shot, because I'm trying to remember when the last time I got that shot, how long are you protected if you get that shot?
So for the Tdap, that's got your tetanus, your diphtheria, and your pertussis, okay? And as an adult, you should get it once every 10 years.
Okay.
Okay, pregnant women should absolutely get this vaccine because when you have a baby, the baby doesn't automatically have protection, and so through the placenta you are actually giving your baby protection against this bacterial infection. And anybody who's around newborns should also be getting vaccinated for this. When you are a child, it's called the DTaP vaccine, and you get that at 2 months, 4 months of age, 6 months of age, 15 months of age, and then again somewhere between 4 or 5 years old.
And that one's called DTaP instead of Tdap.
Exactly.
What's the difference, I guess, in the makeup of the shot for
They're
children?
similar. It's just more of what's appropriate for that age group.
And so they can start getting it at 2 months, you said?
Absolutely, and you should, because again, that's your most vulnerable patient population is your infants who can get really, really sick from it. And whooping cough is no fun. I mean, you cough, the cough is so intense. It's like this dry cough. And then at the end of the attack, it's almost like we call it whooping cough because you whoop, you go, and it can like absolutely take your breath away.
So that explains why it's so dangerous for babies and small children to have. Where can people go for more information on the whooping cough and the vaccine that's appropriate for their age?
So the CDC, they have all of on the CDC website, you'll see all of the printed information about facts. You should go to your pediatrician if you're worried about your child, or if you think it might be time for a booster, or your primary care doctor. Also, you can get these vaccines at like Walgreens, CVS. I just got my booster at Ochsner. So, I mean, you can go to any place where they give typical vaccines and see if you're due for a booster because you don't want to get whooping cough. That's all I have to say. It is not fun.
And you don't want to give that to a baby or a small child.
Absolutely.
Dr. Mehta, thank you as always for your time. We appreciate you.
Thank you so much for having me.
All right, time is now 8:17.